I started Women's Health Foundation because of my experience as an incontinence patient.
Welcome to the world's biggest pelvic wellness workout. When women start experiencing bladder control problems, it takes them 7 to 12 years with symptoms before they bring it up to their healthcare provider. It takes them 4 times bringing it up to their healthcare provider before they get treatment.
I thought, wow, there is a big disconnection between all of these resources and all of these women.
There is a problem that affects 1 in 3 women. Here to tell us all about it is the founder of the Women's Health Foundation, Missy Lavender. Missy!
We've been really focused on research because when we started, there wasn't anything really around what a community-based program could do for women.
We're trying to discern what young women know about their bodies and behaviors that they're engaging in. We're trying to deliver an educational curriculum, and then we're measuring it after the intervention.
We train instructors who then go into their community and teach women.
The constant pressure pushing down to have a bowel movement can cause pressure and weakness. Nobody ever wants to talk about chronic constipation, but we do.
I didn't realize how very delicate the seduction process has to be to get women into conversation. There's this sisterhood of silence. Millions of women don't seek care because they're ashamed or embarrassed. We really want women to understand that they are not alone, that this condition is common but not normal, and there are so many things that they can do for themselves and healthcare solutions that aren't always drastic.
I'm 92 years old. It was the first time I'd been to a class like this before.
Usually, as women, we don't get this information until something goes wrong. Remember day 1, and I said we're going to talk about pee, correct? And I said we're going to talk about poop.
Teaching a young girl what she's doing now that could have an impact on her life in 50 years is powerful when you talk about prevention.
What is a bladder irritant? Okay, so that's an example of a bladder irritant.
Stuff that works on your bladder. It's stuff that makes you have to go like really there.
It's not often talked about, not just sex, but going to the bathroom or, monitoring how you stress your pelvic muscles or how you use your muscles down there. I think that a lot of people can benefit from it.
It was an empowering experience in the sense that I found so many people right here to talk with about it.
After taking the Total Control program, I noticed results in probably 3 weeks. It was so empowering for me. I felt led to share it with others. My mom, with my sisters, with friends, with people in the doctor's office, with people at my church.
That's how we break the sisterhood of silence.